How can I educate myself about myeloma and be an active participant in my care?
I believe it is essential for you to be actively engaged in your healthcare team. If you feel that you personally cannot do this, appoint someone to advocate for you. Research shows people who work side by side with their team tend to experience the best possible outcomes for their given situation. First, you need to educate yourself. Use the internet. Engage in patient communities that share information. Then engage in meaningful discussions with your healthcare team. Ask questions about your myeloma so you fully understand your disease. Know how your cancer is being monitored, what tests are being used, and why. Share your side effects with your team, both your physical and your emotional. Discuss treatment options and the pros and cons of various available protocols. Ask about clinical trials. Talk about articles you read or newsworthy items. And make sure you request copies of your medical record. Ask your healthcare professionals to explain anything that is confusing to review on your medical records. And then review them for accuracy. The age of paternalistic medicine is coming to an end. The most underused resource in the healthcare community is the patient. Let's make that change.
Our team of patient advocates are experts on myeloma and the resources available to patients. They have decades of experience with myeloma to help you know exactly what is available to learn all you can about myeloma and be empowered when it comes to your care so that you can advocate for yourself. Here are the top resources they recommend. Websites you can learn from.
So there are many sources of education to help you become a more active participant. They include disease websites such as ones that are available from the International Myeloma Foundation, the Multiple Myeloma Research Foundation, the Leukemia and Lymphoma Society, Myeloma Crowd, where educational videos, webinars, and interviews are plentiful.
Now there's so much on the web, and what you need to go to is very reliable sources of information. I would say one of those is Myeloma Crowd. Another one is the International Myeloma Foundation, and a third is the Multiple Myeloma Research Foundation. Those are three of the major ones, and also LLS, which is a Leukemia Lymphoma Society.
There are many good websites, the MMRF, Myeloma Crowd, webinars, LLS, IMF interviews. There are just many places where you can find ways to educate yourself on myeloma, and it's important that you do that because you have to make your own decisions.
The Myeloma Crowd website was started with a goal to explain myeloma and the progress happening in myeloma in the easiest way possible. The site includes the latest research, life with myeloma stories, clinical trials, and other resources, all explained in a way we as patients can understand. All articles are shared on our Facebook pages and in our patient, family, and caregiver groups. When I was first diagnosed, I wanted to get up to speed on clinical trials in multiple myeloma because today's clinical trials are tomorrow's therapies. And the more of us that join clinical trials, we can accelerate the pace of research much, much faster. So I started a program called Myeloma Crowd Radio, where I interview top myeloma doctors and just ask them, what is this trial about? Why would somebody join this clinical trial? Who can join the study? Where is it located? How does it compare to other trials or treatments in myeloma? Once you start hearing more about the medications that are being tested and approved and used in the clinic, you start getting a sense of when you may want to consider a clinical trial and how long it will take new treatments to come to the clinic. You can find the Myeloma Crowd radio shows on the Learn tab on myelomacrowd.org.
Learning from support groups.
You can get probably the best information from others who have your cancer, and the best place to find them are in support groups. Get to a support group and talk to somebody who's been there and done that. If you're facing a stem cell transplant, for instance, I guarantee you'll find many in support groups who have gone through that procedure. You'll find others who are taking the same treatment plan that perhaps your doctor is contemplating giving to you or that you yourself have decided to take.
Support groups are another way to become an active participant. There are 150 myeloma support groups around the country. It's a great way to meet other patients, share experiences, and listen to experts as well.
Learning from live patient meetings.
These organizations all have seminars available as well, where they will bring myeloma experts to a town near you, hopefully, to help educate patients.
As I learned more about myeloma and my knowledge became deeper, I wanted to hear from top myeloma doctors about the latest in research. I wanted to understand myeloma at a more detailed level. So we started the Myeloma Crowd Roundtables. They're all-day patient meetings on a Saturday with live presentations and question and answer sessions with about 4 or 5 top researchers and doctors in myeloma. You can find upcoming and past roundtables on the Learn tab on myelomacrowd.org.
Learning with social media.
Social media can play a role via apps like Facebook groups or smartpatients.com or Twitter, where you can follow your favorite doctor and other myeloma patients.
The Myeloma Crowd hosts a large number of Facebook groups. Some are just for patients, some are just for family or caregivers. We also host specific groups for certain genetic features like 414 or deletion 17. In total, there are about 10,000 patients using our Facebook groups.
Using Healthtree to learn about myeloma.
My name is Courtney Thompson. I have multiple myeloma, and I wanted to share my experience and my feelings about this amazing and powerful tool called Healthtree, which has the potential to really help multiple myeloma patients like me, not only in navigating our own disease, but in getting better treatment, getting in contact with appropriate clinical trials, finding treatments, and even possibly helping doctors and researchers find new treatments and possibly one day a cure. I went ahead and joined and uploaded my information, and I found it to be very, very helpful. Well, I was diagnosed 2 years ago, just about 2 years ago. At the time, you know, you're in shock, you're overwhelmed. It was very hard to keep information straight, drugs straight, and dosages and all that kind of thing. And at first it wasn't so bad, but after the first couple of months, the treatments weren't working. And so I was in and out of the hospital, and they were trying to find a treatment that worked. And so I very quickly had to get second and third opinions. And it was very difficult to keep all of that information straight. And if I would have had Healthtree, it would have been so much easier, as I was in this very stressful time trying to prepare to talk to new doctors and present my information in a concise way, as it does in Healthtree. You upload your information and it's all right there. You can boom, print it out. You've got your health history, and it would have been so valuable to me at a very difficult time.
What do your myeloma twins do, or people who have a similar set of issues, and what is their treatment and what is their longevity as far as survival is concerned? And given that, Healthtree, I think, would be an outstanding tool to help you manage your disease and to learn.
I also think that the feature of being able to connect patients with clinical trials, and as well as finding recommended treatment protocols. For example, 80% of myeloma patients aren't being treated by a specialist. And if you're treated by a specialist, which I'm very fortunate to be, you have a better chance of living longer. So trying to get information and good recommendations out to the vast majority of patients who are maybe being seen by a local oncologist, for whom, myeloma is not, it may be a very small part of their practice, is potentially very valuable. And I went in and I looked and saw even though my treatment is working now and I'm in remission, I was able to see what Healthtree would have come up as a possible recommended treatment, and it's right there at the top of my list. And that gave me a lot of confidence in all of the thought and care and careful research that has gone into putting together Healthtree. I just feel like it's a potentially such a valuable tool, not only for us as myeloma patients, but in helping the broader research community perhaps find a cure one day for myeloma.
Learning about myeloma with Healthtree University.
I think the best way to get educated on multiple myeloma is a program we developed called Healthtree University, which you're watching right now. It includes over 30 courses from over 60 myeloma specialists, expert patient advocates, myeloma nurses, and other healthcare practitioners. Our faculty are the best of the best in the world. They have volunteered their time to help answer basic questions they get every day in the clinic. We have over 600 answers to questions like, what is a monoclonal protein? Or what are light chains? Or how do I find a social worker? Or where can I go for financial help? When I was diagnosed, there were a lot of resources online or in patient meetings. I appreciated them so much, but at the same time, it took me 6 or 7 years to really get up to speed on the disease. And that was because I was getting a little bit here, a little bit there, and I had to put it all together myself. With Healthtree University, you're able to start with myeloma basics and work your way up to more complicated questions. Healthtree University has these great animated videos, PDF downloads that might be appropriate to that lesson, and each class has a quiz to test your knowledge and help you retain the information. You really don't know if you're listening or not until you take the quiz. You can watch the videos in the privacy of your home or in the clinic while you're getting a treatment or waiting during an infusion, and it helps you understand all aspects of myeloma from the most basic to the most complicated topics for every type of patient, whether you're a newly diagnosed or relapsed myeloma patient.
Healthtree University provides an enormous bank of experts that can discuss every single aspect on the diagnosis, monitoring, therapy of multiple myeloma. There are archived experts discussing supportive care, management of pain, management of anemia. It's really a one-stop shop for everything multiple myeloma. And I think it really empowers patients and actually is in their best interest to have an account with Myeloma Healthtree because it's an encyclopedic access to key information, including the newest available information on multiple myeloma.
You have much more ability to manage your disease than I ever did, or anybody who's had the disease for several years. But you can learn from everything that we've learned because we would like you to have a better life than we had.